Mr. President, from the moment President Trump and Republicans began trying to jam Trumpcare through Congress, I heard from family after family in my home state about the damage their efforts to undermine families' health care would do. And this last week was no different. Again and again, my constituents told me what a difference it makes to have affordable insurance, to know that benefits like substance abuse treatment are covered, or to worry about how they would manage if Trumpcare ever became law. Now, I heard some of my Republican colleagues went out of their way to avoid those kinds of stories when they were home, so I wanted to make sure they heard a few examples now that they are back in town. And I appreciate that many of my Democratic colleagues will be sharing stories as well that they heard from their constituents over the past few days. Mr. President, like many of my colleagues on both sides of the aisle, I come from a state where the opioid epidemic has had a devastating impact. It has been both heartbreaking and inspiring to talk with patients and families who are doing everything they can to fight back. And right now, the message I'm getting from them loud and clear is, we do not want Trumpcare. One of my constituents, a guy named Daniel, was injured in the military. He was given a prescription for painkillers. He was on them for 8 years, and during that time, he told me his 3 daughters wondered why he wouldn't play with them. Eventually, Daniel changed doctors and was prescribed Suboxone, which made all the difference for him. He is now able to work again. He manages a grocery store, but he relies on Medicaid for health care coverage, which covers the hundreds of dollars a month his prescriptions cost. Daniel told me that if he loses Medicaid under Trumpcare, he will not be able to make ends meet, and all of the progress he has made will be threatened. I heard from a constituent named Rachel in Seattle, who was addicted to opioids and living in her car when she found out she was eligible for Medicaid. She got connected with Swedish Medical Center in Seattle, where she received wraparound health services, including mental health care and primary health care. Now, she and her husband are successfully in recovery, and they're raising a family, and Rachel is going to school. But just like Daniel, they do not know what they will do if Trumpcare becomes law and the Medicaid coverage that is keeping them going is taken away. Those are just 2 of the countless stories I heard from patients and families and doctors in my home state and nationwide. I've heard from cancer survivors who have fought back as hard as they can and worry that Trumpcare will allow insurance companies to price them out of care because they are labeled now with a pre-existing condition. Heard from young parents of medically fragile children who stay up at night worrying about how to afford care for their toddler if lifetime caps on coverage are imposed under Trumpcare. Seniors who simply don't have the savings to cover the premium spikes that Trumpcare would cause. Women and men who are furious, and rightly so, that a group of 13 men wrote a bill in secret to defund Planned Parenthood, the nation's largest provider of women's health care, removing a quality, affordable provider from communities where it is now very difficult to get care. These stories are all powerful. They make it undeniably clear just how much Trumpcare would hurt people. So it is no wonder that Senate Republicans spent the last week laying low and avoiding defending, I believe, the indefensible. Mr. President, Senate Republicans have read the same independent Congressional Budget Office analysis as we all have. They have heard from countless doctors and nurses and hospitals and nursing homes and patient advocates about all of the ways that Trumpcare would raise families' costs and take away coverage. They know people across the country are completely, resoundingly rejecting Trumpcare. It is the least popular bill in 3 decades, according to one study. All in all, Trumpcare shatters every promise President Trump and Republicans made about providing insurance to everybody and making sure no one is worse off. And incredibly, the extreme right wing still thinks it leaves too much of the Affordable Care Act intact. But Mr. President, even though it seems you would be hard-pressed to find anyone who wants to stick up for Trumpcare, including, by the way, President Trump, Senate Republican leaders are still doing everything they can to jam this through Congress as quickly as they can. They are working on backroom deals as we speak and coming up with new ways to sweeten the deal for Senate Republicans who are rightly wary of voting for a bill that would so clearly do so much harm. In particular, I wanted to address this afternoon the ongoing effort by extreme conservative senators to double down on pulling the rug out from under patients with pre-existing conditions. They put together this two-track plan to make middle-class workers and families pay more. If they get their way, insurance companies would be back in charge and tell patients with pre-existing conditions or anyone who happens to get sick in the middle of the year, tough luck. And they will do that in a way that even conservative experts predict will cause premiums and deductibles to skyrocket. Senate Republicans are coming up with other ideas too, like an opioid fund that a Republican governor said is like spitting in the ocean. Let me be clear, there is no fixing Trumpcare. No tweak around the edges is going to turn Trumpcare, which, by the way, is just a tax break for special interests in the healthcare industry on the backs of patients, by turning it into a healthcare bill that actually helps people. There's just no way. Trumpcare, as the president said, is mean at its core. And unless it is dropped altogether, Senate Republicans are going to have to decide whether they stand with their party or the people they came here to represent. So to everyone out there who has called and written and rallied and tweeted, you are having an impact. You are why Trumpcare isn't already law. But you cannot give up now, and Democrats here in the Senate won't either. We're going to keep doing everything we can to make sure Senate Republicans can't hold their noses and vote for Trumpcare just to hand big corporations a tax break and President Trump a hollow political win, whether it's next week or the weeks into August. And I also want to remind my Senate Republican colleagues, again, we have made clear all along the way, there is a better way to do this. Democrats are ready. We are willing to work with you on policies that make health care more affordable and workable for patients and families. So I'm here today to say I hope you all listen to the stories that our Democratic colleagues are bringing to the floor. Think about how devastating Trumpcare would be and do the right thing. Drop this mean bill once and for all so all of us can get to work on real health care solutions that actually help people afford care, get covered, and stay healthy. If you do, you don't have to defend this defenseless bill a minute longer. Thank you, Mr. President. I yield the floor.